Hi guys, welcome back to Ask Doc. My name's Shane and I'm a final year medical student and neuroscience supervisor at the University of Cambridge. Today we're going to be talking about how best to approach the start of your clinicals. Right, so let's begin by discussing the main goals of the beginning of your clinicals. So I'd like to break this into 4 goals. The first goal is learning how to take good, focused, targeted and comprehensive histories. Which brings us on to our second goal, and that's learning how to perform good clinical examinations. Those clinical examinations include cardiovascular examination, respiratory examination, abdominal examination, a neurological examination, including both upper limb, lower limb, as well as a full cranial nerve examination. And then you should also be proficient at MSK or musculoskeletal examinations. So that includes things like shoulder examination, knee examinations, hip examinations, as well as a GALS screen, which stands for gait, arms, legs, and spine. So that was the second goal, which brings us on to the third goal, which is learning how to develop a diagnostic process or framework. So essentially, how to use all the information from your history and clinical examinations to arrive at a diagnosis as well as a differentials list. Okay, so what we mean by a differentials list is once you've given the most likely diagnosis, you should also include a list of other diagnoses that it could be. Which brings us on to the fourth and last goal, and that is knowing the basic management plans for the most common pathologies and diagnoses that you're going to be making, as well as knowing the management for the major emergencies that you're most likely to encounter. So, just some general advice for the beginning of clinicals. Something that I often struggled with is knowing when to leave. I sometimes, especially at the beginning, felt obliged to stay because I've turned up now and I'm sitting in a clinic, and like I mentioned in previous videos, the consultant is either ignoring me or I'm not really gaining that much, or I'm seeing the same type of patients over and over again. Initially at the beginning I thought, oh okay, I've committed, I have to stay until the very end. But then soon I realized actually I can leave. I can just be like, oh, thank you so much for your time. I am now going to go do some of my own study or own revision or whatever, and leave. And the doctors are completely fine with that. I mean, they're not really that bothered if you're going to stick around and stay around, because often you're more a hassle than you are a help to them. So actually, yeah, if you feel like you have used up all the usefulness of that clinical experience, leave and do your own work or do other things you need to be doing. Another thing that I often get asked is how much time do I spend on the wards and on clinics versus reading? And that's a bit of a tricky one, because unfortunately, at the end of the day, the way you're going to be examined really does test how much time you've spent reading something. And this is especially true for the written exams or the SBA exams. So unfortunately, you do need to spend a good amount of time sitting down, reading and learning about the pathological conditions that you've encountered in your clinical experience, or that you've read in the Oxford Cases book, or that you've come across elsewhere, because that is important. However, like I mentioned, one component of your exams, which sometimes in some medical schools is weighted more than the written exams, is your OSCEs or your practical exams. So that really does require you to build up a good patient manner and ability to interact well with patients. And you can only really do that if you see patients regularly, turn up to clinics. So in terms of how you should manage your time, I would recommend at least seeing one patient a day. So going in at least for maybe a couple hours a day and just seeing one patient, taking a full history and examining them from head to toe. So perform all the main parts of the cardio, abdo, resp, neuro exams and present to a doctor. And then, that's good enough. That's a good clinical exposure you've had. And match that up with your reading. So once you've done that clinical side, go back and read something about maybe the condition that you've seen, or a condition that you didn't really know that much about that was mentioned in a lecture, etc. So that has been a quick summary of how best to approach the start of your clinicals. Hopefully you guys have found this very useful, and if you have, please like, share and follow. Make sure as many medical students as possible knows about what we're trying to do and makes use of us. But that's it from me for today, and I'll see you guys next time.